The One Beautiful Bill Act was recently passed by Congress, and it includes significant changes to health care programs all across the country. The bill aims to cut costs and implement reforms to Medicaid, Medicare, and the Affordable Care Act.
Joining us now to explain what these changes will mean to you and your family, Dr. Mehmet Oz, Administrator for the Centers for Medicare and Medicaid Services. Nice to have you back on Good Day.
It's a blessing to be here.
Did you bring us a cake, too?
I have a big announcement today. It is the 60th anniversary of the founding of Medicare and Medicaid, which is the backbone of the social safety net of the country. It is fabulously successful. And one of the reasons it works is because every single day people do their best to make sure it gets stronger. So as a doctor at Columbia Presbyterian, we would take Medicare patients. Almost all doctors do. Anyone who gets to age 65 is given that. But it all started 60 years ago this month. I wanted to make sure everyone celebrated, and I got you a Maha Medicake. Is a carrot cake. I'm just kidding about the carrots being healthy, because that's not the kind of carrots I'm talking about. But it is a great honor to be able to celebrate with this agency, and I get to steward its capital. I get to take care of its finances.
Well, listen, everybody is very concerned because this one big, beautiful bill is going to make changes. And, you know, you listen to some of the people in our area, like Governor Hochul, it's going to be a disaster for New York. They're saying like at least 1 million people, maybe 4 million people could be kicked off, you know, the Medicare, Medicaid payroll. What's going on with that?
Well, first off, Medicare doesn't get touched in any capacity.
What about Medicaid?
Medicaid was going to have a major problem because of things that happened over the last few years, especially during COVID.
Like what?
Well, for example, they stopped asking people on Medicaid. Remember, Medicaid was designed 60 years ago to take care of folks who are very young, right, or disabled, or very old, people who couldn't work on their own. So they changed all the rules to make it possible for anyone to be on Medicaid. They just had to tell you that they needed to be on Medicaid. Well, because of that, there was rampant fraud. And President Trump was very clear. He wanted to deal with the fraud, waste, and abuse aspects of this. We didn't rejigger anything except clean up the system.
But how do you know who's frauding the system and who's not? Because let's face it, private insurance is a fortune.
It is a fortune. You have to ask people questions, and you have to provide tools for them to honorably answer them. So I'll give you a concrete example. Work requirement. Historically, there was no work requirement in Medicaid, although there is for food stamps and other programs of that nature. In fact, the Clinton welfare reform was really all about bringing work requirement into some of these systems. Every Democratic president, every Republican president has said a work requirement is a fundamental part of any social safety net program, because people will game it otherwise. So that was one created in this law. And there's a lot of conflict about that, because Democrats will say, well, you know, you don't have to have a work requirement, or you can't prove that there's a work requirement. Well, first off, the average person who's able-bodied on Medicaid, remember, the program wasn't designed for them. The program was designed for the young, the old, and people who are disabled. But able-bodied people were added to Medicaid, and because of that, we've had a massive inflow of people on the program. But if they're sitting at home, and on average they watch 6.1 hours of television or just leisure time, and they're not encouraged to go out and live their best life, to go out and have agency over their future, they will literally sit there. They're trapped in this welfare system. So we're saying go out and try to get a job. And here's what we're going to do. Since 91% of people with Medicaid have phones, we're going to use smartphones for you to tell us whether you work, or tried to work, or tried to volunteer, or tried to get an education. Go out and change the world. That's part of the reason you're on the planet. So go show that you have agency, and we're going to give you tools to prove that. If you do those things, you get Medicaid for free.
Okay, so here's the counter argument. Everybody already has to check in once a year. This is going to move it to every 6 months that they have to check in about whether or not they're working. Here in New York specifically, half of New Yorkers are on either Medicaid or use the ACH to get health care. Yep. Right? So that's half of the people in a city of 8 million people. The issue is that 2/3 of those people are already working. They just can't afford to have health care without this safety net. What do you say to those people?
Those people keep their Medicaid, they keep their Affordable Care Act insurance. We want those programs to be strong. Again, I took this job to protect Medicaid, but when you looked at the program as it was changed over the last year, and I'll give you one good example, there was a dramatic shift in how much money was being drawn down from it, so much that it puts the program itself at risk. Here's the classic example. 1 year ago, there was a decision made that you could pay a doctor taking care of a Medicaid patient, the federal government could, and the state government, 3 times more than a Medicare patient. Kurt, think about that. Medicare patient put money into the system. Your paycheck is a 2.9% tax every time you get money. It goes to Medicare, so when you're 65, you can retire knowing you've got access to good care. Medicaid patients, sometimes able-bodied individuals who could be working and could therefore get themselves off Medicaid, they're given 3 times more money to their doctors than the Medicare patient. So the Medicare patient's got to wait further back. They have access to care issues. We're saying just demonstrate you're trying. You don't even have to get a job. Just try to get one, or volunteer, or participate at home with your kids, or take care of, get an education for yourself. Do something that shows that you care about society. We don't even call it a work requirement, Kurt and Rosanna. We call it community engagement. That's what this bill is about. And the frustration that so many seem to have about this, to me, is about the confidence you have in the American people. Because here's the deal. If I say to you, will you take the offer, try to get a job, just call and try to get a job, and I'll give you free insurance, will you take it or not? If you say no, well, that means you don't think much of the American people. I have confidence in the American people. I know they'll take that deal.
But the dollars still aren't there. If you're removing $1 trillion, you can say, well, it's going to be something that if you show me you can work, you still keep it. But at some point, the numbers don't add up.
The numbers do add up. Here's why. We're putting $200 billion more into the program. $200 billion more. We're just not going to let the abuses continue. And there's an extra $50 billion that people everywhere in the country can use as long as they're underserved areas, especially if it's a rural area, by the way, but underserved areas. So that $50 billion is out there for Governor Hochul and other governors. All 50 governors have to apply for it. We're making the process seamless, and that money starts coming out at the end of this year. You apply right now. If you've got a good idea to help get more health workers in place, support our hospitals, have a digital modernization of Medicare, this is the time. The investment that the administration is making in truly dealing with the underlying problems of the system. Listen, as a surgeon, I'll tell you, I can operate in your heart, which I did for many years, and fix the blockages caused by a life of bad habits, or I can address the bad habits. We're all in this together. The reason I brought that cake in part is to celebrate the fact that if Medicare is here for you, you've got to be here for Medicare. If we do it together, it's a collective agreement. It's a joint operation.
So, Dr. Oz, what I want to say is, you know, there are a lot of people who are concerned. What do you say to people like Governor Hochul, the people who run the New York City Health and Hospitals Corporation, who says this is going to be a disaster, which is scaring everybody because this is not going to happen this year, but next year,
Not
correct?
next year, 3 years from now, and very gradually, and many states won't even be impacted. The changes, again, are about fraud, waste, and abuse. It's about people being registered for Medicaid here in New York and in New Jersey and in Connecticut, because every governor says, well, I'll take the money because you're giving it to me. It's about, by the way, that's about $14 billion. And you should know that last week we announced the largest bust of fraud in this country. It was against, of course, Medicare and Medicaid. Why? Because they're a big target. People come after us, and foreign governments are involved in this fraud. So we've got to clean the system up. Asking you to tell us what you're doing is not too much to ask if we're giving you free health care insurance.
Hey,
Help us clean the system up.
I apologize. We're out of time, but I do want to ask you one more question here, is that you hit on a key point. A lot of fraud happens from provider standpoints, not necessarily the recipient. What are you doing? What's in this bill to stop that?
We have funding across the board to digitally modernize healthcare, to actually track the information the way a bank tracks deposits, the way you can get a streaming video at home without having a problem, or get food delivered to your home. We should have similar digital advances in healthcare. When you go to your doctor's office, why are you writing down your name and your address over and over again? Show your phone, a QR code, and your doctor will automatically have your information. We have got to bring healthcare into the 21st century when it comes to the basic customer service element. That's how we're going to prevent the fraud from happening in the first place. That bust we had last week, a lot of providers were involved in that. A lot of hospital systems, doctors, etc. Some of them taken advantage of. Others were actively involved in this process. Our promise is to make sure the money never leaves the door, because once it leaves the door, it's in the Cayman Islands, it's in Russia, it's gone.
All right, you know how television works. We're getting yelled at by our producers.
What does this mean? What does this mean?
That thing he was doing 3 minutes ago, we're way over time. Thank you for coming and explaining it.
Thank you,
God
Dr.
bless you
Oz.
both.
Say hello to the family.
Let's get to Mike real quick. Mike, make up the time.